Hi, I'm Ben Hirschenfang. I'm a consultant with Global Public Health Services and former aerospace engineer, program director. And today I'm talking with George Vaughan. George, can you please introduce yourself?
Yes, good morning. My name is George Vaughan, and my background is public health, in particular, disease control and epidemiology. I'm a retired public health officer from the Commissioned Corps U.S. Public Health Service.
So we have an epidemiologist talking with an engineer. This should be interesting. So we're going to talk today about the impact of COVID-19 on the cruise industry. So I have a few questions for you, George. If you can answer this, I really would appreciate it.
Sure.
First one is, can you discuss the origins and evolutions of the CDC's framework for conditional sailing for return to sailing for the cruise line industries?
Sure. The CDC Framework for Conditional Sailing Order, or CSO, sometimes called the framework as well, was implemented following the no-sail orders that went into effect on 14 March of 2020, which also had 3 subsequent extensions and modifications. The no-sail orders actually expired on 30 October of the same year, and the CSO went into effect on the same day. The purpose of the framework, or CSO, is to assist the cruise industry in its safe return to cruise operations within the United States. The CSO uses a 4-phased approach, which includes a series of activities with the idea of bringing safe operations to cruise ships within the United States. The first phase, or phase 1, involves mass testing, and usually that's through nucleic acid amplification tests or antigen testing, along with the laboratory capacity building, including onboard testing capabilities on cruise ships. Phase 2 involves voyage preparation, including screening, testing, a 14-day quarantine requirement for a newly embarking crew, the development of port medical and housing agreements that are approved by the port and local health authorities. Phase 2B has specific requirements for a simulated or trial voyage, including approvals to conduct those simulated voyages and requirements for after-action reporting. Phase 3 of the CSO involves procedures for the issuance of conditional sailing certificates, which indicates cruise ships have met CDC's public health standards. And finally, phase 4 outlines restricted passenger voyages, which include resumption of passenger operations with shortened voyage lengths as well as testing requirements. The guidelines for compliance at each phase of the CSO is provided through a series of technical instructions and supporting documents, which were published at different intervals based on the evolving science under the pandemic conditions. The CSO remains in effect until the 1st of November of this year, or if it's rescinded by the CSO director.
And what's the current status of the framework, and what are some of the challenges for implementation of the framework?
Well, to my knowledge, all aspects of the framework have been outlined in technical instructions by the CDC. They're pretty detailed, and I'm sure there's going to be some challenges in the implementation of the framework. Some of the ones that I think that may be challenging include the enforcement of passengers' compliance with the mask mandate, which is required on cruise ships, as well as other conveyances, and as well as in transportation hubs, including cruise terminals. Similarly, I think the enforcement of physical distancing requirements that are also under the CSO in some areas, public areas specifically of the cruise ship, such as buffets, a pool deck comes to mind, and indoor entertainment areas of the ship, such as theaters and clubs, could tend to be a challenge for enforcing those particular social and physical distancing requirements. I think in addition, in the crew spaces, crew areas, since they tend to be small, and constitute congregate living in social spaces, that social distancing or physical distancing requirements could be a challenge there as well. I think managing the inevitable SARS-CoV-2 outbreaks and the initial contact tracing efforts that are also required under the framework may present some challenges for the cruise ship operators as well. And then finally, I think that consistently maintaining the recommended vaccination levels when they are ultimately published and other public health interventions to prevent outbreaks could be of a challenge. This will be particularly challenging, in my opinion, with the proliferation of the SARS-CoV-2 variants that may impact vaccine efficacy.
How do the variants play into any possible impacts to the framework and operations of the cruise lines?
Well, I think that the variants will have a significant impact on, or potentially have a significant impact on vaccine efficacy. Now, we have several very good vaccines that are available, and the cruise industry was pretty excited about the fact that the vaccines were available. Now, in terms of the CSO requirements, recall that if a cruise ship operator can attest to 95% vaccination status within both the passengers and the crew, they can forego certain phases of the framework and proceed to the final phase, phase 4, which is where they conduct more robust sailing, although albeit it's somewhat reduced in terms of normal sailing activities. However, the variants can really impact the efficacy of the vaccines, or at least has the potential to do so. And in that case, my concern would be if it reduces the efficacy of the vaccines to a certain level, then that puts the cruise ship at risk of outbreaks potentially. So I think it's an important aspect to follow and to consider, and particularly with the potential for breakthrough infections and so forth for those that are vaccinated with the current vaccines. So it may require in the future also that a booster be administered. So operationally, that would require the cruise line operators to provide boosters to their crew. And so operationally, that could impact them.
And especially since they'd have to consider their ports of call and what that country's requirements are for acceptable vaccines.
That's true. Exactly. Mm-hmm.
Well, that leads me to the next question is, how do vaccinated versus unvaccinated passengers play into the framework?
The latest CDC recommendations, as I understand it, under phase 2B of the framework, is that if a cruise ship operator can attest to 95% vaccination rates within both the passenger and the crew populations, then the cruise ship operator can actually forego the simulated voyages under phase 2B and proceed directly to the restricted passenger voyages under phase 4. That would be to the cruise ship operator's advantage. Obviously, there are less hurdles that they have to, bypass in order to get back to full operations under the CSO framework. There may be challenges in reaching and maintaining that 95% vaccination standard in the crew, I think, particularly if the expectation is that the cruise ship operators is to vaccinate cruise members in their countries of origins, since vaccines are not as plentiful outside of large countries. Information on vaccination status. For example, the governor of Florida has a lawsuit pending against the CDC regarding requesting that information on vaccination status, the so-called vaccine passport issue. This could hamper the cruise line's ability to properly identify those who are fully vaccinated. There's also a recent development where some cruise ship operators are not accepting mixed vaccinations with AstraZeneca vaccine with the mRNA vaccines. This is a practice that, while not something that's done in the United States, has been done in other countries and is an accepted standard, such as in Canada. However, is not accepted here in the United States. So that may present some problems in reaching that level. Also, these issues, I think, could potentially impact the cruise ship operators' ability to comply with the CSO framework.
So, George, once you have both vaccinated and unvaccinated passengers on board, what are the challenges operationally for the cruise lines in handling that mix of passengers?
Well, I think that the cruise lines have implemented certain operational strategies that allow fully vaccinated passengers and I suppose crew to participate in the full spectrum of shipboard activities, as well as shore-based activities as allowed by the specific countries in where the ports, where they make port calls, when compared to the unvaccinated persons. Separating out, I think, the activities aboard the cruise ships by vaccination status can be challenging. Although I understand that the cruise lines have implemented strategies to properly identify vaccinated versus unvaccinated persons and which groups are allowed to participate in those certain shipboard activities. Additionally, I think that the unvaccinated persons will be required to show negative COVID-19 tests and may be subjected to more frequent testing and shipboard and shoreside restrictions. That would mean that the cruise ship operators would have to conduct more testing in the unvaccinated populations. I have also read that some of the cruise lines will require that unvaccinated passengers carry a certain amount of travel insurance to cover medical emergencies. Recall that that was an important aspect of the outbreaks that occurred on cruise ships at the beginning of the pandemic, where medical treatment was difficult to obtain. Operationally, I think enforcement for non-compliance of any of the health and safety protocols are going to be needed to be strictly enforced. It remains to be seen, however, whether the cruise ship staff will be able to take the necessary actions when cruise ship operations are fully operational, in my opinion.
I've also heard, George, that passengers will be charged, I think, up to $150 for the test pre-boarding. So that is another operational item that I've read.
Yeah, I've heard the same thing, Ben. Yes.
So what can be done to educate passengers both before and while they're on board on proper precautions to avoid transmission of the virus?
Well, I think that there are some things that the cruise ship operators can do to educate passengers before they arrive to the ships, as well as when they're on board the ships. And we've learned a lot through other pathogens of concern on cruise ships like norovirus. So I think they have some history with understanding how to properly educate passengers and their crew members on the risks of transmissible communicable diseases. I think under the CSO, there's requirements while they're on board the ship to educate passengers and crew on the proper wear of face masks. Also, there's a requirement to educate the shipboard population on the physical distancing requirements, as well as other public health protocols. There's also a requirement to post signs and messages in highly visible locations to reinforce the public health expectations. And traditionally, the cruise ship operators have conducted public service announcements during the daily briefings of both passengers and crew by shipboard management to ensure the public health messaging is clear and concise and is consistent. So, so that's also published in their daily newsletters also. Obviously, proper hand hygiene practices is vital to the control of any communicable disease on board the shipboard environment. And educating passengers and crew in the proper reporting of symptoms of any communicable disease, but of course of SARS-CoV-2 infection to cruise ship medical staff is something that needs to be reiterated consistently during the course of the voyage. Now, before a person embarks on a cruise, I think it's important for the cruise industry to educate them through the different means of contact in preparation for boarding the ship of what the expectations are in terms of public health prevention strategies.
So we know we have criteria for things like norovirus for reporting cases, thresholds. Are there any thresholds established for reporting COVID cases during a cruise?
Sure. There's requirements, obviously, to report any of the symptoms that are consistent with SARS-CoV-2 infections or COVID-like illness as well. That's outlined in the framework also. Typically, when something is considered to be an outbreak, usually that's 2 or more laboratory confirmed cases. In this case, shoreside, that is specifically what the definition is of an outbreak. That is 2 or more laboratory confirmed COVID-19 cases linked and with linkages to establish that, with linkages outside of the case investigations and contact tracing. And during that contact tracing, the identification of 2 or more contacts with active COVID-19 infection. So contact tracing is important to that case definition and outbreak definition as well. Also, under the CSO, for simulated voyages, the CDC has established a threshold for termination of the voyage. This is an operational consideration. And the CDC advises that a voyage be terminated immediately if 1.5% of COVID-19 cases are detected in passengers or 1% is detected in crew. And the CDC advises that these thresholds are also subject to modifications based on the lessons learned. Of course, this is an ongoing pandemic, so as new science comes out, this is subject to modification. But currently, that's what CDC is using as the thresholds for termination of a voyage. They're subject to, obviously they'll be subject to an investigation, and that would be based on CDC's recommendations and requirements.
And that leads me to ask about isolation and quarantine. Can you define the difference between the 2 terms?
Sure. Quarantine is the separation of people who are exposed. They aren't showing symptoms at this point, but they're exposed to, say, a COVID-19 case, and quarantine is designed to separate those individuals from the general population so that they could be evaluated to determine if they develop symptoms of the disease. Quarantine is not often used as a disease control strategy and is actually reserved for a list of diseases that are determined to be quarantinable. Now, SARS-CoV-2 or COVID-19 is listed as a quarantinable disease and is actually published in a series of executive orders. Isolation, on the other hand, is reserved for confirmed or probable cases of a communicable disease. In our case, of course, that's COVID-19. Isolation includes measures that would be taken by the cruise ship operators to ensure that the separation has occurred between passengers and crews who are infected and are displaying signs and symptoms of the disease. including if they have tested positive for SARS-CoV-2. So that's the difference between essentially quarantine and isolation.
Thank you. What do you see as the criteria of safe to sail with respect to vaccinated passenger percentage on board and herd immunity?
You know, I don't think that there's going to be a difference between the vaccination level percentage-wise, shoreside versus the shipboard environment. I think CDC has already stated that they believe that the vaccination levels should be 95% in passengers and crew, considering that those levels to be a safe to sail standard. And I think what they've done is they've taken into consideration the unique nature of the environment aboard cruise ship and cruise ship travel. However, I do think that given the close quarters and of the shipboard environment, that other public health actions are needed to ensure the safety of the traveling public and the shipboard personnel. This includes like the actively promoting high hygienic standards and environmental sanitation procedures, the physical distancing, the mask wearing that we've already discussed, the health screening of passengers and crew of boarding, and the isolation or quarantine as needed.
Have you heard about any evidence of increased exposure due to shore excursions, which is typical for most cruises?
No, not to my knowledge. The literature that I've read doesn't show a causal link demonstrating increased risk of infection associated with shore excursions. One of the studies that I did review didn't demonstrate an association between the numbers of people visiting a specific port of call and increased risk of COVID-19 to that receiving country or the port community. So as it stands now, I have not seen any literature that really says that there's an increased exposure due to shore excursions. However, there are many, many different types of shore excursions. So I think, that's relative to, what are the activities on those shore excursions. I think CDC takes an approach that there'd be a cautious approach actually to the close environment on shore excursions as a precautionary measure for disease prevention.
You mean like on a bus?
Yeah, exactly. Transportation during shore excursions. And in some cases, depending upon what the shore excursion entails, there could be other activities that puts an individual at increased risk for a specific type of activity. But there are way too many to try to discuss that at this point.
And on board, what are the most significant routes of transmission of COVID?
Well, I mean, the SARS-CoV-2 is a respiratory virus is transmitted through direct contact and through respiratory transmission. Most transmission is thought to occur at a distance of less than 6 feet or 2 meters, which is why we have the specific physical distancing requirements and so forth, although there is some mounting evidence to suggest that airborne transmission is possible and in some cases likely. The cruise industry has taken steps to modify ventilation systems on a number of their ships to minimize the possibility of airborne transmission of SARS-CoV-2 virus causes COVID-19. Specifics include things like enhanced filtration and updating the cleaning and disinfection protocols, just to name a few.
And I've also seen where UV lights are added to some of those ventilation systems.
Sure.
To also kill the virus.
Sure.
We read in the framework about the necessity of port agreements for the cruise lines to have. Can you describe what these port agreements entail?
Sure. There are a number of port agreements that are required under the CSO framework. And the idea behind those is, of course, not only to protect the people that are on board the ships, but also to protect the people who support the ships as well. And so there are specific requirements in terms of cleaning and disinfection protocols. There's a development of contractual agreements for medical evacuation and medical care at various US ports. And that's a result of some of the problems that were identified when outbreaks occurred early in the pandemic on cruise ships, and getting access to medical care ashore was quite difficult, including evacuations from the ship, if you recall. Also, there's a requirement for developing housing contractual agreements to accommodate that isolation and quarantine needs that might occur should there be an outbreak on board a cruise ship. The requirements are all in response to the SARS-CoV-2 outbreaks aboard cruise ships and the strain that it placed on the US port community. So there's an attempt to reduce the impact of an outbreak on the receiving community, the supporting medical staff, and so on. So that's what, excuse me, that's why the port agreements are required.
Okay. And as far as lessons learned goes, do you think the cruise lines are postured for the next pandemic?
You know, given the experience that, we've had with this pandemic, I think there are a number of lessons learned that put them in a new position to prevent at least the severity of the next pandemic by some of the measures that we've described so far. I mean, the physical changes on the cruise ships in terms of the ventilation systems, of course, would help with the amelioration of, respiratory outbreaks, not only from SARS-CoV-2, but any other respiratory diseases, such as influenza, that pandemic influenza that might occur in the future. Also, I think some of the strategies and protocols for managing large numbers of people in the cruise ship environment, there have been plenty of lessons learned there that are instrumental in minimizing transmission of not only respiratory diseases, but gastrointestinal diseases and so on. And I'd be interested in knowing, actually, when the cruise ships actually do return to full operations, what the disease experiences would be before and after the implementation of these public health measures. I think we'll see reductions in not just respiratory diseases, but some other communicable diseases as well. Now, once the pandemic threat is realized, what's going to be important is that there's strong leadership at all levels within the cruise industry to have proper public health procedures and protocols in place and to enforce those, particularly in the face of pushback, which will inevitably occur. I mean, we're seeing that now under the current pandemic. One difficulty I see is, as with all outbreaks, is the human behavioral aspects of disease control. So strong public health messaging that is clear and concise will be required, in my opinion. But they should realize that they will not be able to convince everyone of the need for the operational changes. And so they just need to be aware of that. My last thought is that the cruise industry should not focus attention on a single communicable disease, but by using risk assessment techniques, develop strategies to address any communicable disease, past, present, or future. And I think the lessons learned from this pandemic, brings that to light. So I think they are in a better position for future pandemics. Yes.
Well, George, you've gone through great detail on the origins of the framework for sailing and all the factors that are involved for both passengers and the cruise line industry itself operationally. I'm sure there'll be quite a bit of training that the cruise lines will require to implement all these changes. Is there anything else you'd like to add to the discussion?
Well, I think that the cruise industry should be commended for their efforts in improving the public health standards on board the ship. I think they always are in a position to do that and are always striving to do that because it's mutually beneficial. Of course, it's beneficial to their business as well. But I do think that they've done a really good job in identifying the risks and putting in the necessary steps and interventions to reduce the risk of communicable diseases and to improve public health on board the ships.
Well, George, thank you very much for taking the time to help us understand all this today. And we hope to talk to you again soon.
Okay. Thank you so much for having me.
Okay. Bye-bye.
Bye.